Hello everyone, thank you very much for joining us on this short webinar where Dr. Ocker will be answering your questions about live blood analysis. Thank you very much for submitting your questions and we'll be answering them shortly. If you do have a question during the webinar, please could you locate the questions box in the panel on your screen? You can enter your questions there. We'll endeavour to answer throughout. If not, we'll answer at the end with a Q&A. And you'll also see there's a full screen button. This is the best way to view the webinar. So I'll be handing you over to Dr. Ocker now to get your questions answered. Hello, Dr. Ocker. Are you ready to answer some questions?
Hi, Elizabeth. Hi, and thank you very much. Yes, absolutely.
Marvellous. Right. The first question is, what does live blood analysis actually show?
All right. Well, live blood analysis is a test that's ideal for any natural health, nutrition, or functional medicine practice, since it gives us information about specific key parameters that we, as natural practitioners or practitioners in this field, need to test and monitor to be able to decide on the best treatment or interventions for our clients. Now, conventional medicine has a wide range of tests and investigations to help the practitioner make a diagnosis, but in the field of natural health, a client's medical diagnosis doesn't necessarily tell us what to do for them in terms of treatment. We need information that goes a lot deeper than conventional investigations, to enable us to understand the client's health on a more complex and holistic level, how the interplay between various underlying imbalances and the challenges have contributed to the client's overall condition. Now, live blood analysis allows us to detect and monitor these imbalances with the added benefit of also being able to show our clients in a very practical and visual way evidence of what we're seeing in their system. Now, specifically, there is a long list of imbalances and indicators that can be detected, such as oxidative stress, toxicity, stress, and the functional health of various specific organs, acidity, various deficiencies, many interesting microbial indicators, degenerative patterns, and much more.
Thank you. So what does the test procedure involve and how long does it take?
Well, the test itself involves taking a drop of blood from a client's finger and analyzing it under a special type of microscope. We prepare two samples from the same pinprick, one for live blood analysis and the other for dry blood analysis. Now, it is a visual analysis, so the trained practitioner would physically scan through the relevant areas of a sample, looking for particular indicators or deviations from what a healthy or normal sample would look like. An essential part of the analysis is that the client's sample is viewed on a monitor during the consultation so that the client can see for themselves what their sample looks like. The practitioner then discusses the various anomalies that are detected with the client, drawing parallels between the anomalies and the client's symptoms, and also how specific factors in the client's diet and lifestyle have contributed to what was seen in their blood. The analysis itself takes approximately 30 to 45 minutes, with the whole appointment typically being around an hour to allow for the discussion of the findings and the recommendations.
Thank you. And a lot of people don't realize that it's actually done with a lancet, isn't it? There's no drawing of blood.
Yeah, absolutely. So there's no drawing of blood from a vein with a syringe. It's just a finger prick. So with a little lancet on the client's finger, similar to what one would do if you were to monitor your blood sugar level at home, for example.
Thank you. And the next question is, What type of equipment is needed and what does it normally cost?
Well, the equipment used for live blood analysis is a specialized bright field and dark field microscope with a specific type of camera attached to the microscope with a cost of around $5,000 to $6,000 for the whole system. Now it is important to mention though that not all dark field microscopes are suitable for live blood analysis. Dark field itself is a technique that is used in microscopy. It's not unique to live blood analysis. So there are many dark field microscopes available from microscope suppliers, but most dark field microscopes are not suitable. And also many microscopes that are sold as dark field live blood analysis microscopes are also not suitable. Now this is because there are a very particular set of specifications needed in a microscope to make it suitable for analyzing live blood in dark field. Since we are involved in the training for live blood analysis, and also because I personally work in the field, we know exactly what is needed in a microscope to make it suitable for live blood analysis. Now we have a separate webinar where we discuss this in a lot more detail, showing how the view of the blood changes when one of those essential specifications are changed, and how this then impacts on your ability to properly analyze the sample. We can perhaps share the link to this video after today's webinar for those who are interested in looking into this in more detail. You know, having the correct equipment is absolutely crucial to being able to assess blood samples correctly. And this is a common pitfall for new practitioners because there are some dark field microscopes online, you know, that are a fraction of what a professional system would cost. And we supply the best microscopes for live blood analysis, and they will allow you to see everything that is covered in the course. And we've researched microscopes extensively, and we regularly compare our systems to other microscopes that are available out there, since we often have attendees who ask us, you know, if a microscope that they've come across would be suitable. Our microscopes are the best price systems available for those specific specifications, and we've yet to come across a system with the same specifications at a better price.
Thank you. So I'll put that link in the recordings that I send out. So everybody should be receiving the link to that webinar or video. I'm not sure which it is. But just it would seem that a lot of suppliers of live blood analysis microscopes claim that their microscopes are good for live blood analysis and dark field microscopy, but it would seem that they don't actually know the specifications for live blood analysis, so they're not sort of deliberately misleading. It's a very specialized subject, isn't it?
Well, yes, absolutely. So those suppliers invariably, you know, they're not involved in live blood analysis at all. They don't, you know, involved in training for live blood analysis, and they certainly don't use it themselves. So they simply just don't know what the specifications are, and they're obviously assuming that if, you know, you're able to do dark field with a microscope, it should be suitable for live blood analysis. But, you know, we know, based on you know, how we've been trained, and also from what we've actually seen in samples, that you actually need a very particular type of microscope to be able to properly analyze live blood samples. And unfortunately, you know, the types of specifications that are required are you know, are quite costly. It's not an entry-level type of microscope at all. The optics need to be very high quality. The light source needs to be very strong and very bright. And there's a specific type of condensers and so on that need to be used as well. So not entry-level type of specifications. And as a result of that, these systems tend to be quite costly.
Thank you. Next question is, how much space is needed in a consulting room for the equipment?
Well, you'll only need space for the microscope itself, which can usually go on one side of a desk, and then the slides and the cover slips and the other consumables. Most people have a separate monitor also to allow them to show their clients their blood samples on a separate larger screen, but it isn't essential. The microscope itself measures around 20 centimeters, or I think it's 7.8 inches wide by 30 centimeters, or about 12 inches deep, and then about 55 centimeters or 22 inches high. So, it's not really large, and can easily just be placed on one side of a desk.
Thank you. And how long does it take to become proficient in live blood analysis?
Well, becoming proficient in live blood analysis requires, well, a good knowledge of the theory, and also being comfortable and confident with the practical aspects, in other words, the taking of and preparing blood samples and using the various settings on the microscope to view those samples. Now, this does take a bit of time, but because of the way that the course has been structured, where the theory is covered in easily digestible chunks each week, the practical aspects are covered in week 1. Attendees then have sufficient time to learn and practice the technique during the 12-week course. And we usually find, that they're able to start seeing paying clients then at the end of the course.
And what diseases can be seen with live blood analysis?
Yeah, that's an important question. It's not used. Live blood analysis is not used to diagnose diseases. We really can't diagnose disease by looking at a drop of blood under the microscope, and that's not really what live blood analysis was developed for. And when it's used successfully in practice, the purpose of the test is not to diagnose disease. The real value of live blood analysis lies in its ability to uncover the underlying imbalances in the body's internal environment that have facilitated the development of disease. So although it can't be used to diagnose disease, it provides valuable information on the underlying causes of disease, which is very difficult to, nearly impossible to uncover with any other technique.
And if it can't be used for diagnosis, why is it useful in a clinical medical setting? So how will it help patients?
Right, so I've mentioned the most important benefits of live blood analysis earlier, in terms of it being able to uncover the underlying imbalances that are, well, nearly impossible to uncover with any other technique, and also how it helps to motivate clients to make the necessary changes in their diet and lifestyle. Now, this is obviously extremely valuable in a nutrition or natural health or integrative type of practice. Now, in a purely medical setting, it would really come down to what your goals are, as a practitioner for your patients. Do you want to help your patients achieve and maintain optimal health, or do you just want to diagnose and manage diseases as and when they develop? This again comes down to the difference between healthcare and disease care. And practitioners who are involved with integrative medicine and complementary medicine are not just satisfied with simply treating their patients' symptoms with various combinations of drugs. They want to understand the underlying physiological processes that precede the development of a disease or a symptom, and what role various factors from the client's diet and lifestyle played in the development of the disease. So understanding these causative and contributing factors then allows the practitioner to treat his or her client more holistically. And it also helps them to understand how these conditions can be prevented in other patients. So using it in a purely medical setting to its full advantage would Well, it would require a fundamental paradigm shift for the practitioner, and would definitely take the practice out of the scope of conventional medicine. However, it does still have some value in a conventional medical practice because we are looking at blood. There are signs that will appear in the sample as a result of specific diseases and disease processes. So there are some indicators that can be associated with particular diseases. We do cover this in the course, how the sample may be affected by certain diseases. And this then also depends on your scope of practice. If you're able to diagnose, then there are indicators that you can use in the blood to narrow down the list of conventional investigations that may be needed in a case to make a diagnosis. Now, I've seen this in practice a number of times as well. One example is a patient of mine who had edema, water retention in the lower limbs. Now, this could be due to a number of conditions or due to a number of reasons. And when we looked at her blood, there were many kidney indicators. So instead of having to send her for many different types of tests and investigations, we just investigated the kidneys, and we were then able to diagnose nephrotic syndrome. Now, the real value of live blood analysis then becomes apparent in a case like this, because we were then able to identify and address the underlying cause of the nephrotic syndrome instead of having to rely on conventional management, which would invariably just be there to manage the symptoms. So in her case, we saw advanced signs of chronic acidity and leaky gut syndrome, which we addressed with our normal natural protocols. And as a result, we were able to reverse the condition.
Thank you. Next question is, do I need a medical background to practice live blood analysis?
No. So live blood analysis is not a medical diagnostic test, so a medical background is not a requirement. It is a technique that fits into the scope of natural medicine, nutrition, or as it's often referred to, complementary and alternative medicine, or CAM. The imbalances that we detect with live blood analysis fits squarely into the realm of complementary medicine. So any person practicing any form of natural health or working in the field of nutrition will benefit from using live blood analysis on their clients.
Thank you. And next question is, I have a limited background in the medical field. How much does the course material cover? Would I need to acquire additional training?
Yeah, so no additional training would really be required to understand and grasp everything that's covered in the course. All the definitions and everything that relates to more conventional hematology is covered in the course, where we reference specific medical conditions. There is a glossary at the end where those terms are defined and explained. So there's no need for any additional type of medical training to understand the concepts around live blood analysis and the implications. And since it is a tool really ideally suited to any natural type of practice, any additional training in the field of nutrition or in terms of any modalities that can be used in a natural health practice relating to things like detoxification and so on, can easily slot into a practice where live blood analysis is used.
Thank you. How much variation is there in the findings in a patient's blood from one day to the next? And how easily are the signs in the blood affected by a person's day-to-day lifestyle and diet?
Okay, so this relates to the reliability or repeatability of the test. Some people who are skeptical of live blood analysis mention this as one of the potential problems with the test. That there are many factors that will affect the outcome of the live blood test, which may then mean that a patients' results will vary dramatically from one day to the next based on what they had to eat, when they ate, and how much water they drank, for example. Now, in practice, however, we simply don't see this type of variation. Now, of course, if a vegan decided to have a large steak and a few hours before a live blood test, then we can expect to see the impact of this in the blood, definitely. But for patients following their normal daily routines, the results are always accurate and reliable. We actually see the opposite of what is suggested here in practice. Patients tend to present with a very specific mix of anomalies that don't really tend to change unless the appropriate course of treatment is completed. So they would have a list of perhaps 10 anomalies at the first appointment, and if they don't really make the necessary changes, we will tend to see the same 10 anomalies then when they come back, even if it's several years later. It's almost like a metabolic or functional fingerprint that we're seeing, and it really won't change unless very specific steps are taken to address those anomalies.
Thank you. And should it be done on every client?
Well, yes, absolutely. You'll discover a fairly quickly, when using live blood analysis, that the information gained from the analysis makes your job so much easier that you'd want to use it with every client. It provides valuable information in nearly every type of client, regardless of how well or unwell they are. There's always something useful that can be uncovered in the blood. And then the process also of the client being able to see the condition of their blood for themselves is always valuable in practice because it helps to improve compliance. It quickly becomes a crucial part of your practice, and since it often uncovers things that you would never have thought of testing for or considering in your assessment of a case, you would probably feel that you might be missing crucial information about your client and your case if you're not using it as part of your assessment. Your clients also tend to expect you to check their blood. They often come in specifically to see what their blood looks like.
Thank you. What other tests will still be needed after a live blood analysis session? And how often will I need to refer for further testing?
Yeah, that's a very good question. In the majority of cases, live blood analysis can be used as the main test or investigation, and it will provide sufficient information on the most important issues that need to be addressed. We're obviously not able to see everything, so there are some cases where further tests may be necessary. For instance, we would see signs of a viral infection, but we won't necessarily know what type of virus it is, or there may be signs of an allergy, but we won't know what specifically the client is allergic to. Further investigations in those cases are then needed, to provide more detail. However, we don't always need this information to treat clients effectively with natural treatment protocols, so they're not always necessarily referred for further testing. If we see signs of parasites, for example, knowing the specific type of parasite won't really affect the treatment used. It would still be the standard herbal formulation for parasites. But there are a small percentage of cases where further tests may be necessary. For example, if the signs are not improving after the recommended interventions, or if specific indicators are seen that may be indicative of more serious medical conditions.
Thank you. And we have another microscope question. Will any microscope be suitable for live blood analysis?
Well, no, definitely not. Not all microscopes can be used for live blood analysis, and as we mentioned earlier, even many of the microscopes advertised as dark field live blood analysis microscopes are not suitable. And since we are involved with the training and also because I used live blood analysis in my own practice, we understand what is needed in a microscope for it to be suitable for live blood analysis. Unfortunately, normal suppliers don't know this, and they think that any dark field microscope will be suitable, but it simply isn't the case. And we also know from having tested various microscope specifications that changing any of the essential specifications will affect what you're able to see in the blood. So we do have a video available where we showed this, and it is a good idea to have a look at it just to see for yourself how things change with different specifications on the microscope. It is a common pitfall to new practitioners, and of course having the correct equipment is absolutely crucial in enabling you to see and to use live blood analysis to its full potential. But it is also important just to mention that we will still enroll attendees with basic microscopes. If you don't have a proper professional dark field system, we will still enroll you in the course, but it is really important to then upgrade to a professional system before seeing paying clients, because you would be missing a lot of really important crucial information in your clients if you don't have the correct system.
Thank you. And do you cover specific treatments for the signs seen in the blood analysis?
Well, yes, we do. We list specific protocols under each anomaly in the manual, and this is also covered in detail and includes specific herbal and naturopathic formulations, as well as dietary and lifestyle changes to address each specific anomaly.
And do you know of service centres for the microscope in South Africa? What impact have you experienced under the current COVID conditions as far as service of the equipment goes?
Well, the microscopes are actually built to be fairly maintenance-free. They're built to be reliable and dependable, and you would be able to use them in your practice without any type of downtime due to the microscope having to go in for service. It really just involves preventing dust from getting into any of the essential components. So the way that the microscope is built, unless you disassemble the system, dust won't really get into anything. The lenses are sealed, everything is set up so that it works the way that it should. But if you do feel that it needs to, have a proper setup again, if some of the settings seem like they've gone out and you're not able to set it up with our instructional videos on how to do that, then there are service centers available. So in South Africa, I'm based in South Africa myself, so you would be able to send the microscope through to me for me to actually test it and set it up for you. And for our attendees from elsewhere across the world, there are agents that can service the microscopes as well. Also, in cases where it is a requirement, we will be able to refer you to someone in your area. It also obviously depends on the type of microscope that you have. So the systems that we supply are built to be quite sturdy and reliable, but some of the other systems may need a bit of regular servicing, and it has been affected somewhat by the COVID-19 lockdown. Some businesses have not been able to operate. Courier companies were not able to operate at the in the sort of high levels of restriction, but things are easing up a bit now. So as long as there's a courier service, you would be able to get your microscope to a service center, in a case where it is necessary.
Thank you. What about cleaning under dusty conditions in rural areas?
Well, the microscope is supplied with a dust cover. As I said, the lenses are sealed, and there's really very little risk of dust getting into any of the essential components, as long as the system isn't disassembled. The areas of the microscope that are exposed, like the bright field and dark field condenser, the little lens at the base of the microscope where the light comes through, those components can be easily just wiped with a clean, dry cloth, to remove the dust. So it really isn't very difficult to manage that situation.
Thank you. And the next question is, will I still be able to do the course if I can't attend the live lessons?
Yes, absolutely. So because the lessons are recorded, you'll still be able to access the recordings if you're not able to attend the live classes. Now we have attendees from all over the world in different time zones who then view the recordings later and post their questions to the private Facebook page. The fact that the lessons are recorded is also very useful for giving practitioners the ability to go over and review the lessons as many times as they like. And also if you've had to miss a lesson for any reason. We believe that providing the recordings, we offer a huge advantage in our training course.
The next question is, will I need hands-on training?
Well, we believe that we provide the best format, to study live blood analysis. What you would learn from hands-on training is actually covered in detail in the course during the lessons and also in the form of videos. We go through the microscope settings and how to take the blood samples correctly in detail. And since everything is recorded, you can always go back and view and review it as many times as you like. Now, this is not the case with hands-on training, where we found that people often forget much of what they learned after a 2 or 3 day hands-on course, and then they have nowhere to go to review the information.
Yes, a lot of people say that it's just too much information to take in a 2 or 3 day hands-on course.
Absolutely, it is. If you really are dedicated and you want to learn, the theory as quickly as possible, you would be able to do it faster than the 12-week sort of time period that we have in the course. But 3 days is really not possible. It's a lot of information to cover in 3 days. So people tend to get overwhelmed. They remember a small fraction of the information, and even the practical aspects is simply too overwhelming when it's just over 3 days.
And what are the risks of the procedure?
Well, since we are working with blood, there are some risks to yourself and to your clients. However, the risks are minimal, because it really is just a drop of blood taken from a finger prick. And these risks are very easily mitigated with some simple measures. Now, we do cover this in detail in the course, but essentially it involves using disposable gloves, new sterile lancets, and of course disposing of the used sharps correctly.
Is it possible for clients to get COVID from a finger prick?
Yeah, we actually have had this question before, so we've looked into this in a bit of detail. And according to the literature, COVID-19 can't infect someone through an open wound. Viruses can enter the body through open wounds and cuts, but a virus has to attach to its specific receptor on the surface of a susceptible host cell to start off an infection. Now, in the case of COVID, the necessary receptors aren't there, which means that infection via this route is not possible.
Thank you. And is there any research to back up live blood analysis?
Well, yes, there have been a number of studies. Now, it is often, if you look on the internet, you'll find that it is often referred to as a pseudoscience, and it's criticized that there is no scientific research behind it, and that it's some sort of gimmick that's used just to sell products. However, much of what we see in live blood samples have been researched and proven many years ago in conventional hematology. There are, however, other anomalies in live and dry blood that were identified clinically by researchers working with live blood analysis and dry blood analysis over the course of many years. Now, many of these relate to conditions that can't be tested for with conventional investigations. So they are quite difficult to verify in a way that would be acceptable to conventional medicine. But we always see the anomalies respond to the recommended interventions. With regards to actual research, there have been a number of small studies that have shown a very strong correlation between the findings in live blood analysis and conventional blood tests. Because live blood analysis is much more sensitive than conventional blood tests, this is not something that can be done for all live blood analysis anomalies, but in some of these studies, they looked at anomalies that can be easily detected in conventional blood tests. So for example, anemia indicators in patients with iron deficiency anemia, liver indicators in patients with liver disease, and so on. Now, live blood analysis was shown to be very accurate in these cases. In one study, the authors were able to demonstrate an equal sensitivity between dark field microscopy and standard chemistry analysis for the variables that were studied. A number of other studies and conference papers have shown a positive correlation between pathology markers and dark field microscopy. But these are also mostly retrospective clinical observations and reports on single patients or small groups. Now, another recent study from 2015 showed a very strong correlation between specific live blood analysis indicators and metabolic syndrome. Now, all of the studies in live blood analysis are, of course, not to the scale that's required by conventional medicine, but they do show that what we are seeing in blood is reliable and does stand up to scientific testing.
Thank you. What's the difference between live blood analysis and other tests used by natural health practitioners, such as the quantum analyzers and biofeedback devices?
Okay, well, that's an interesting question. In terms of what can be identified, there is some overlap between live blood analysis and some of these other devices. And we've seen a fairly strong correlation between results from live blood analysis and certain biofeedback analyzers used by experienced practitioners. The actual test itself is obviously very different, and this is also quite relevant then in terms of the perceived credibility of the test. Clients are generally quite confident in the results from live blood analysis, since they can see that it's just their blood that's being analyzed without anything being added or changed, in their sample during the analysis. Whereas they don't really understand how a biofeedback device works, and it's also quite difficult for a practitioner to explain how these devices work. So people are generally more skeptical of the results. We've also found that in live blood analysis, it's very easy to determine what the most important priorities are for each client's health. Only the most important issues are usually detected using live blood analysis, whereas after a biofeedback analysis, it can be difficult to decide on where to start as often there's just too much information. Now, lastly, the visual impact of live blood analysis really is unparalleled. Nothing really compares to it, and no other test has the same effect in motivating people or sometimes giving them the wake-up call that they need to make the necessary changes. Now, I've used many of these other devices in my practice, and I've seen without question that live blood analysis makes the greatest impact in practice.
Yes, it certainly has a huge impact on people. What are the most common findings?
Yeah, absolutely.
What are the most common findings in live blood analysis?
Well, in live blood analysis, although it's called blood analysis, we're actually more involved with analyzing the state of the biological terrain. So we can see factors that influence the biological terrain or the health, the balance of the biological terrain quite clearly. So things like over-acidity, various imbalances in the microbial balance in the system, things like candida, the presence of other bacteria or microorganisms, parasites, and then also functional imbalances. So whether the immune system is functioning properly, whether the digestive system is functioning properly, whether there's specific stress on any of the specific organs, things like adrenal stress we can see quite clearly, a whole range of other imbalances in the organs in general, things that are very, very sensitive that you won't be able to detect at an early stage with conventional testing, like for instance blood sugar imbalances, as well as stress or toxicity in the liver. So there really is a list of probably about 100 specific anomalies for the live blood itself, and about another 50 or so for the dry blood. But generally, it relates to the biological terrain, and very similar, the analogy that's often used is, the fish tank. If the water in the fish tank is at the correct balance and has the correct nutrients in it, then the fish in the fish tank would be healthy. So similarly, if your cells, your cells would be like the fish in this analogy, the cells that are being bathed by the fluids in the body, which would be the biological terrain. If the fluids are out of balance, then these cells would become unhealthy as well. So we can clearly see what's going on with the biological terrain, and then addressing those imbalances then results in getting the system to a point where it's actually able to overcome whatever challenge or imbalance is actually affecting it.
Thank you. And is live blood analysis legal?
Well, yes, it is. There are some states, I know, in the US where the medical council has tried to prevent the practice of live blood analysis, but the technique is not regulated, and there are practitioners in those states that are using live blood analysis. Instead of using the term live blood analysis, they say they are using it as an educational tool to educate their clients on nutrition, diet, and lifestyle, which is actually what it does. The only real risk is when practitioners make claims about being able to diagnose medical conditions, which is of course not what live blood analysis should be used for. Now we do cover the legal aspects in detail during the course, to ensure that our attendees can use the technique safely without putting themselves or their clients at risk. There is provision for something called pastoral medicine in the US that many practitioners make use of, that then allows them to practice safely without any legal risk.
Thank you. Will I be able to offer blood cell analysis after training?
Well, yes, we do. We issue a certificate which is CMA approved. although live blood analysis is not regulated, it is important to be able to prove that you've been properly trained and that you've received formal training. Most attendees who started working with the correct microscope from early on in the course are able to start offering live blood analysis in their practices by the end of the course.
Thank you. And do you provide backup?
Well, yes, absolutely, we do. We provide email support to our course attendees and also full after-sale support with a 2-year warranty on our microscopes. We also have the private Facebook page where attendees can post questions, interact, and continue learning.
Thank you. Are you regulated?
Well, yes, we are. We are CMA approved. That's the Complementary Medical Association in the UK.
Thank you. Any more questions, please put them in the box. Thank you very much for that, Dr. Ocker. We hope this has been helpful to you, and we are
Thank you.
We are here to help and advise on all aspects of live blood analysis. We do have a training course starting on September the 29th, which is next Tuesday. So you can enroll on the website or send me an email at info@livebloodonline.com and I can help to get you enrolled. And I just hope that's been very helpful to you. We don't seem to have any more questions. If you do, please put them in the box or email them in to us. And thank you very much for joining us. So anything to add to that, Dr. Ocker?
Well, I think if you're interested in live blood analysis, it's definitely would be a good idea to actually see if you can find a practitioner who has actually trained with us and see if you can actually have a test done for yourself. That usually would show you whether this is something that you actually would be able to use in your own type of practice. But it is also a good idea to check where the practitioner has trained, because in our course we have combined the perspectives of various researchers in the field. So we're not just providing the perspective of one particular researcher. We've actually combined everything into a comprehensive course. So people that have trained with us have quite a broad and comprehensive understanding of what's going on in the blood. So their approach in practice would often be quite different from other practitioners out there.
And there is a list of practitioners in all countries around the world on the website, which is www.livebloodonline.com, and just click on the practitioners tab and you'll be able to find some practitioners there. And I'll be sending out a link to the recording, and on there we'll put some videos, one about microscopes and one about the legality and efficacy of live blood analysis. So if there are any more questions, please put them in the box. If not, we'll say goodbye, and thank you very much for joining us. So thank you, it's goodbye from me, and thank you very much, and goodbye, Dr. Ocker.
Thank you very much. Bye-bye.
Bye-bye.